We are seeing an increase in cases across the reservation. And as you mentioned, we span across North and South Dakota. And so we rely heavily on, good leadership from both states, and their decisions impact our communities heavily.
Yeah, I got to imagine that even if the reservation is distinct in terms of its governing structure and its sovereignty, it is, inevitably intermingled with the rates of community transmission in the folks around you.
Exactly. We rely on outside communities for shopping. People work off the reservation. We have off-reservation people that come onto the reservation to work in our schools and our healthcare system. So we're very much intertwined with those communities. I think my frustrations as a public health professional is that we really need leadership to be following the science and to be following the expert guidance on how community members can do their part in addressing the spread. And we've just not been effective at doing that.
Let me ask you this. In New York in March and April, which was basically the worst outbreak in the world at that point, and probably still, maybe city in Ecuador here or Brazil here and there, but at that point the worst. It got really bad. People were inside. They heard the wailing sound of sirens all the time. 1 out of every 400 New Yorkers died. And it traumatized people. I mean, they were traumatized. They knew people that got sick. They knew people that got died. And they were like, this is awful. What is the social life world experience of this pandemic on your reservation and in those states now as the numbers per capita head towards New York levels?
Well, I think it varies. We have, especially in North and South Dakota, we know that there has been major resistance to, wearing face masks. There's been a debate about their effectiveness and whether they're, even work, and suggestions that maybe they're even harmful to our health. And so we have that attitude, but we also have, I think within our reservation communities, we do have people that are taking this virus seriously. They know that we are losing precious lives. They know that it's important for them to do their part to reduce the spread, and that has been what we've focused on when we're educating our communities. It's about doing things for the greater good. It's about making good choices, being a good relative, doing everything that we can to make sure that our communities stay safe and healthy, but we don't see that across the 2 states that we share territory with.
What is the healthcare capacity that your tribe and reservation has?
So we do have an Indian Health Service facility. It is a 12-bed hospital, but we definitely have reached capacity several times during the pandemic, and we rely heavily on outside healthcare facilities to meet those higher level of care needs for our patients. And so when we talk about the healthcare capacity across North and South Dakota, that is scary for us too, because we rely on those healthcare facilities, and when their capacity is dwindling, we know that we're going to have to be searching farther and farther for our community members to have the level of care that they need. And we're disproportionately impacted by this virus. We have, higher rates of the pre-existing conditions that put us at risk of developing complications, and so this hits us hard. When our people are getting sick, they're getting really sick, and they're needing those higher levels of care.
All right, Tasha Peltier, who works in the Standing Sioux Tribe there in North and South Dakota, thank you so much. I really appreciate it.
Thanks.
That is all in this evening. The Rachel Maddow Show starts right now with Ali Velshi in for Rachel. Good evening, Ali.
We're 8 months into this pandemic, 8 months in, and our frontline healthcare workers are still sounding the alarm about the lack of personal protective equipment, the lack of testing and contact tracing, all of which are basic containment measures that we have heard about repeatedly for 8 months. Right from the beginning, the experts said testing and contact tracing in particular are key ingredients to slowing the virus and reversing the surge that we are seeing nationwide now. But in some places, the virus is so bad that contact tracing is next to impossible. Places like North Dakota, which currently has the highest COVID mortality rate in the world. One contact tracer in North Dakota wrote in an op-ed in the Washington Post describing how drastically her work as a contact tracer has changed since the virus began to overwhelm the state. She explains, quote, "Things got so bad so fast that we surrendered one of our key weapons against the pandemic. Test and trace went by the wayside. Even if we had enough staff to call up everyone's workplace and contact, There are so many new infections that it wouldn't be as effective. At this point, the government has given up on following the virus's path through the state. All we can do is notify people as quickly as possible that they have the virus. She continues, quote, what began as a 15-hour-a-week position is now a round-the-clock job. My phone buzzes constantly with calls and texts from my cases, reporting symptoms and asking questions. Legally, I'm not allowed to give medical advice, but I direct them to the right services and sources of information. Mostly, I just try to listen. Some people, when they are sick and in isolation, just want to talk to someone so they don't feel so alone. When you get down to it, listening to a person's worries is both the least I can do and the most I can do to help, which is awful to think about. Joining me now is Kylie Langang, a North Dakota contact tracer and senior nursing student at the University of North Dakota. Kylie, thank you for joining us. Thank you for what you do. There are people like you, thousands of them across America, who we don't know unless the phone rings. And because I travel, my phone does ring from contact tracers. And they're just trying to gather some basic information from me that get put into a system that is supposed to give us a map, to sort of tell us, to give us advance notice of what's going on, to be able to warn people who've been in contact with me, and to give authorities some sense of where this virus is going. You said that at some point North Dakota kind of had to abandon the idea that they're actually tracing this virus.
Yeah, and it wasn't so much that we ended up giving up. It was more of we couldn't keep up with it. People were either having contact lists of maybe only 3 people to like 50 different people in one place. It became a necessity of it's more important to contact the cases that are positive and spreading than it was to contact every single contact at that point.
Kaylee, talk to me about what good contract tracing looks like. How's it supposed to go down?
Yeah, so good contact tracing and what we had done originally is we would be assigned cases. Once they test positive, we usually call them. They would already know that they were positive through the clinic or the testing site. And then we would get all of their demographic information, health and medical history, stuff that was more important. And you'd move on to more of where have you worked, where have you been, who have you been around, and putting all of those places into the system. Now, unfortunately, again, that's not something that we can do.
And if you were able to do what you originally designed, the way it was originally designed, how effective is that? What's the goal there, that you can figure out everywhere this person has been and with whom they've been in contact, and then what, try and find all those other people?
Yeah, so the whole thing is to, I would get a list of everybody that you've been around, and then I would contact them individually and say, you have been exposed to COVID-19, you need to isolate for 14 days, and then they would be inputted into the system and get monitored themselves as well.
Talk to me about how this goes. Obviously, each one of these calls is different. You don't have to divulge anything that you're not allowed to divulge, but generally speaking, what happens when you call someone? How do they respond to you?
Yeah, so now it's usually kind of like it was said in that article. People are almost very resigned about it. It's like, of course it was, I thought so. So it's usually just starts with, hi, is this so-and-so? And have you been made aware of your test results? And then you get their date of birth, confirm who they are, and just start talking to them. I like to form a relationship with people more so maybe than others, but it's a scary time, especially if it's your whole family or it's an older person. It's scary. So it's offering all of that, getting their information, seeing if they've worked, letting them know this was when you were infectious, this is who you need to notify. We give need to isolate letters so they can provide that to their employers. And then I usually just leave my personal contact information for them to reach out if they ever need anything.
And you are still running into some people who don't take this seriously.
Yeah, sadly we are. So there are still a good amount. I would say it's less now, but originally, yes, it was a lot of, well, this is political, this is a hoax, or, it's not happening in North Dakota. It's not needed here, that's not true. So thankfully now it's kind of toned down and people are more serious about it, but we're still seeing huge numbers of cases and hospitalizations, and yeah, it's going downhill.
Kayla, you have one of the most important jobs in America, and I will say that 6 months ago or 8 months ago, I didn't even know such a job existed. I didn't know what this was all about. We heard these terms. We were told contact tracing is going to be the most important thing. It's an honor to speak to you. Thank you. History will smile upon you and the thousands of others across America who are doing this important work. Kaylee Langang is a North Dakota contact tracer and a senior nursing student at the University of North Dakota. Thank you for your work and thank you for your time tonight.
Thank you.
The hypocrisy is relentless. It's never ending. They don't care. The president doesn't care what he destroys as long as he can claim victory. Okay? As long as he can claim victory. Today he tweeted out a Reuters poll. The poll shows that Trump's defiance of the election results and his false claims are already affecting the public's confidence in American democracy. So the president who, before he lost Joe Biden, he used to tweet polls about winning, is now tweeting polls about Americans losing faith in our democracy and our elections. As if that is winning for him. Maybe it is. If winning is a zero-sum game where he wins and our democracy loses, believe me, he would be okay with that. Are you? Tonight he remains holed up behind closed doors in the White House, nursing his grievances. Former advisor to the former president, Valerie Jarrett, tweeting, "Someone is hiding in the basement and it is not Joe Biden." Where was Joe Biden? Holding a virtual roundtable with frontline workers today, getting emotional as he listened to, listen to this. This is Mary Turner. Mary Turner is an ICU nurse on the night shift in the COVID unit, the head of Minnesota Nurses Association. Here she is.
I myself have held the hand of dying patients who are crying out for their family that they can't see. I've taken care of co-workers as they fight for their lives on a ventilator. And knowing that they got sick because of the hospital or their government hasn't protected them. I'm sorry, I'm so emotional.
No.
It's just...
You got me emotional. I observed the incredible mental strain on nurses in ICU units.
I don't care what you think about Joe Biden or if you voted for him or not. Don't really care. That is a human reaction to a horrible situation. That is a recognition that we can't go on like this.
The statement actually was quite accurate. It really does depict the situation out here. We're in dire straits. As I've said throughout the last several weeks, I believe that we are in the most dangerous public health moment since 1918. What we're seeing right now with this exponential growth is frightening in several regards. First of all, just the cases and what that means in terms of the serious illness and deaths, but also what it's doing to our healthcare system. It's literally teetering right now. There are hospitals out there that are literally on the brink of being completely overwhelmed for the lack of staff and support efforts. So that this is really a very, very critical moment. And I don't think the public hears that in voices from people like me and others. But hopefully the fear of the frontline workers, like you saw today with that video with the president-elect, will help convince people this is real.
You have been telling us that this is where we were going to be at this point in November all year. Even when we saw that early surge and then we saw numbers start to go down in some places, and you guaranteed us that we would see them go back up, especially at this time of year. It's happening exactly as the way you told us. What should we be doing as individuals and as communities to get from here to this spring, possibly, where we might have access to a vaccine?
Well, I think there's been a real sea change in our journey. You know, a few weeks ago, I did a podcast where I talked about light inside the tunnel, not the end of the tunnel. You know, with the results that we've seen over the past 2 weeks with these vaccines, it gives us all renewed hope that we can make a big difference in this disease. We just have to hold out to get there. So now, instead of people having to just try to reduce case numbers for one more month or one more month or one more month, we can say we need to get to the point of these vaccines arriving. And I think they're going to start arriving soon. We won't have substantial amounts of vaccine till well into the first quarter, in potentially the second quarter of next year. But now we can see a path out. And so we have a choice. Do we want to continue to put ourselves at risk, swapping air with people, which we shouldn't be doing, and getting to the point of developing immunity from natural disease, but also incurring thousands of deaths? Or can we do our best to hold out and get to those vaccines and have a very, very different year next year?
Michael Osterholm, thank you very much for your guidance that you've been giving us consistently on this network since COVID-19 invaded our lives. We really appreciate it. Thank you very much.
Thank you, Lawrence.
Students are going to school. That's extremely important. And I guess the message I would like to put out there to the general public is, take a minute and shoot your school administrator an email or a phone call or a text, and teachers as far as that goes, and school board members, and just, prop them up a little bit and just let them know how much they're appreciated for what they're trying to do in these extremely trying times.
There are 149 public school districts across the state, and Holbeck says that they all have to do what's best for their schools and communities.
Well, Brookings, Sioux Falls, Mitchell, and Huron have passed mask mandates, and Rapid City is considering one. Governor Kristi Noem still calls it making a personal choice. Governor Noem says out of 41 states that have mask mandates, 39 of them are still seeing a rise in COVID-19 cases.
Some have said that my refusal to mandate masks is the reason why our cases are rising here in the state of South Dakota, and that is not true.
The South Dakota State Medical Association has called for a statewide mask mandate to stop the spread of COVID-19. Governor Noem disputes COVID-19 trackers that show South Dakota is among the highest number of cases per capita in the nation. According to Johns Hopkins, the 7-day average positivity rate for South Dakota is 56.3%.
Well, if someone in your house tests positive for COVID-19, you may not need to leave home to get tested yourself. This week, the state will start offering saliva tests for close contacts who live in the same household. The state will give you a code so you can go online and order your test. When it arrives in the mail, you set up a Zoom call, take the test, and mail it in. South Dakota Secretary of Health says that you should have the results within 24 hours. Numerous companies have announced promising preliminary results of their COVID-19 vaccine studies. However, a Sioux Falls doctor says people still need to practice mitigating strategies when the vaccine is first released because not everyone will receive the vaccination right away.
The problem is that we're not going to have widespread vaccine available into the broad population for a number of months. We may have some vaccine by the end of the year.
To learn what other circumstances surround a COVID-19 vaccine, just head to thiskeloland.com original report.
Oh, let's turn to weather where there are some good news and things to celebrate, Adam. It is
gorgeous day. Now let's look at what's going to be happening tomorrow. Temperatures in the 30s. It's not a lot cooler than it is right now. And going into...
What if you had the chance to win a candy factory in real life? One South Dakota family might find it out. David Klein, the founder of Jelly Belly, is holding a real-life golden ticket scavenger hunt for a chance to win a candy factory. Once the clue came out on Saturday, it only took Sheila Brown and her family about 45 minutes to crack the code. And then they set their sights on Sisseton. Turns out they weren't alone when they got there. More than a dozen people were already searching. Now, there was a rumor that the ticket had already been found in the area, but they decided to keep looking anyway.
So the kids were playing on this Army tank. We had young ones running around, and we just started searching, and it ended up being in one of the very first spots we looked at when we got there, so we didn't find it for like an hour and a half later, so anybody could have found it, and it was luck.
This whole search was a family affair. They even had people bound for Belle Fourche. Brown said cracking the code might have actually been more fun than finding the ticket, but they are keeping their eyes on the prize.
Of course, we hope we win. We'll just have to see, I guess, where the story takes us. I'm not sure about running a candy factory, but it'd be pretty awesome.
There are still golden ticket searches going on in more than a dozen states right now. Once that is complete, the contest will then move to a nationwide search.
Lots of fun. Next in sports,
With the first pick,
the Minnesota Timberwolves have the #1 pick in tonight's NBA draft. See and hear from their top pick after the break.
Keep your eyes on the monster Angus.
This is a drafted stash, and a guy who I really like his long-term potential. 6'7" playmaker. He can play on the ball.
Belgium takes the 2-1 lead. Let's skip ahead to the 69th minute.
Pedersen is having to make adjustments.
This year, I'm just going to open up to private groups, small groups, by appointment, and they're responsible for their own conduct, and certainly they're well aware that masks is a necessity.
He wants to keep the Christmas spirit alive, especially during these unprecedented times.
As people gather together and begin to sing, all of a sudden you develop a real tightness and a sense of community in this little place. And I see a lot of tears. In fact, it touches a lot of people's hearts. So my joy is to try to give the gift that keeps on giving as long as I'm able.
Karen Croteville is Pedersen's cousin. She was coming to Nora's store long before Mike started the tradition.
Growing up just a mile and a half from here, we walked by here when we walked to Nora's school up the hill, but it was a pretty place because they had some groceries. And I recall that in the center here they had a big stand that had bread on and rolls and things like that, and all the canned goods were along the back here.
She's continued to come here over the years to take part in the holiday tradition.
I bring all kinds of people here from my family, my grandkids, and tell everybody about, have you been to Nora for Christmas? You have to go to Nora for Christmas.
She says even though this year will look different, she encourages people to consider coming out in small groups.
Bring some of your family, some of your cousins, a couple of your neighbors, whatever it might be. And it still is possible to come because it's very important. To me, it's like Christmas isn't Christmas until we've been here.
When I started 30 years ago, they were little kids. Now they're married and bringing their children, so there's a tradition there.
And while he knows this year's tradition will be different, he looks forward to making the most of it this holiday season.
I think the thing that we most missed here this year is a sense of community. I mean, you come in here as total strangers, and like one lady, she says, you come in as a stranger and you go away as a friend. I mean, we meet people, so that the camaraderie's going to be will be a missed thing. But, it is what it is, and life goes on, and we have to make the best of it.
With Eye on KELOland, I'm Sarah McDonald.
Pedersen says that on November 27th, there will be a one-night open house at Laurel Ridge Barn for singing. It is free and open to the public. Donations are accepted, and if you'd like to schedule reservations at Nora's store, we provided that information under this story on KELOland.com.
The USD men's basketball team begins its
NBA draft. The Minnesota Timberwolves select Anthony Edwards from the University of Georgia.
Okay, that's not the guy who played Goose in Top Gun. The Wolves thinking they found their backcourt complement to D'Angelo Russell by drafting the Georgia shooting guard Edwards. In his only season, he was the SEC Freshman of the Year who averaged 19 points per game for the Bulldogs. Some thought the Wolves would take LaMelo Ball, who ended up going number 3 to Charlotte. Timberwolves instead opting to go with the scoring and defensive specialist who thinks he'll fit in perfectly with Towns and Russell.
I got two superstars alongside of me, so I'm not really going to feel too much pressure. But I'm going to do what I always do, bring what I bring to the table, and just impact the game other ways. Like, they already can score the ball, so defensively I'm going to impact the game. Being the guard, the best guard rebounder on the team that I can possibly be.
Minnesota was busy in the latter half of the first round as well. They had the number 17 overall pick, but flipped it to Oklahoma City in exchange for Ricky Rubio in the 25th and 28th pick. Now, Rubio was the Wolves' 5th overall pick in 2009 and spent his first 6 years in Minnesota. Since leaving, he's averaged about 13 points and 8 assists per game. Now, Minnesota sent that number 25 pick to New York in exchange for the 23rd pick. If we can pull up that graphic, which would be Argentinian guard Leandro Balmero. The 28th pick, they took Washington forward Jaden McDaniels. And with their only second-round pick, they stayed as close to home as possible with Gopher center Daniel Oturu. Now, closer to our home, the University of South Dakota men's basketball team is scheduled to open their season a week from today against Colorado at the Little Apple Classic in Manhattan, Kansas. And perhaps when the team's doing its introduction song, it should be the Who's Who Are You? That's because after graduating 5 key contributors, Stanley Amude and Ty Chisholm are the only seniors. Beyond that, other holdovers from last year saw little to no